Actually, what happened? In the phase 0, this is the voltage rated sodium channel. In few milliseconds, sodium influx takes place and the sodium channel gets closed. Okay. Sodium enters inside the cell. Depolarization, then repolarization by the opening of potassium channel. The potassium enters outside the cell. Okay, potassium efflux takes place. And simultaneously, calcium, potassium efflux. Okay. Phase 2, calcium enters inside the cell and simultaneously potassium efflux takes place. Calcium influx and potassium influx. Is that clear? Okay. Repolarization, calcium channel closed, potassium channel open. That's why potassium efflux takes place. Repolarization, phase 3. Okay, the calcium channel is closed. That's why and after that in the phase 4, potassium channel, calcium channel closed. Then after that, then phase 0, phase 1, phase 2. That's going on. Okay? Clear? Everyone? Any question? Okay, thank you. So, the factors affecting electrophysiology of the heart. Generally, I told about various ion channels, voltage gated ion channels. The various factors that affects the electrophysiology of heart, actually some factors increase the action potential generation, and that's why the rate of contraction increased. So ionic concentration, potassium channel or potassium, in case of the hyperkalemia. What is hyperkalemia? Potassium, yes. In case of the hyperkalemia, that slows the conduction and shorten the action potential. Why? The potassium efflux results repolarization. Okay? And sodium channel, sodium required the very rapid depolarization. And why rapid depolarization? When the sodium channel open, then lots of sodium enters inside the cell very rapidly, and in few milliseconds the sodium channel is closed. Okay? So the next is the calcium. Calcium that involves in the depolarization in the pacemaker cells. Calcium is responsible for the depolarization, you all know. Okay? And then another one factor is the autonomic nervous system. You know that in case of the sympathetic outflow, the heart rate is, if the heart rate increase, then what happened? The sodium and calcium enters very rapidly and the depolarization takes place. More excitations takes place. That's why the optoredeemic fibers that is present in the cardiac muscle that generates more action potential, then more contraction. That's why heart rate is increased. Is that clear? Very good. And in case of the parasympathetic nerves or nervous system, the vice versa is takes place. And pH and blood gases in case of the acidosis that depress the cardiac excitability and the conduction. Okay? So, then another one thing, there is the HERG gene, human ether related GOGO gene. Do you know about HERG gene? Anyone? Okay. That gene, another video. It generally facilitates, just a minute, this is the human ether related GOGO gene. Okay, one word. It has a alpha subunit and that generally facilitates the potassium efflux. Okay, potassium efflux. Then any type of dysfunction of the human ether related GOGO gene that delayed the repolarization. If the repolarization is delayed, what happened? The ST segment is prolonged. Right? Is that clear? Okay. So that is the function of HERG gene. There is a detail about the HERG gene, and in the QT interval. So what is QT interval? I told earlier that QT is the time from ventricular depolarization to repolarization. Ventricular depolarization to repolarization. Okay, the time gap, time between the ventricular and depolarization to ventricular repolarization. Is that clear? Then in case of any defect of the HERG gene, that increase the QT prolongation. Okay? Then we come on the basic difference between the human and the rat ECG. Why rat? Why we are using rats or mice or any other rodents? Do you know? If you see in the biomedical research, any drug molecule is discovered first, then it should be tested on the rodent model. In case of any cardiotoxic agent, we can easily understand by seeing the QT interval, RR interval, ST segments, that whether the drug is cardiotoxic or not. Okay? And after confirming the new drug molecule, then only CDSCO approved this drug molecule for further clinical trial based on the report of preclinical data. Okay? So that's why we will perform today the ECG on rodent. Because if we don't test a drug molecule on the rodent, we will not give, or we will not able to give this drug molecule to a patient or a human. That's why today we will perform the rat or mice ECG. And what are the differences between rat and human ECG? Do you know? Rats are small rodents. Actually, in case of the small rodents, automatically their heart is too short, too small. That's why the conduction path is too short. That's why And what happened? The QT or the QRS complex or RR interval is less than the human. RR interval are less as compared to the human. Okay? Here there is a size of human heart and rat heart. That is the size of human heart and rat heart. There is a heart rate. Human heart rate is 60 to 100 BPM beats per minute, and in case of the rat heart, 300 to 500. There is a range actually. The same anatomical differences are there in between rat and human heart. Conduction system, as I told earlier, SA node, AB node, bundle of His and Purkinje fiber. But in case of the rat, the heart is too small, that's why the path of conduction is small, that's why heart rate is more. Okay? Aorta and major vessels, that is larger, and in case of the branching patterns, vary by strain and can be asymmetrical. Okay? Then that is the similarities of human and rat ECG. As I told earlier that the ion channels, sodium channel, potassium channel, calcium channel, these channels are responsible for the conduction of the electrical impulses or the generation of electrical impulses in case of the rat as well as human. That are the similarity. Another one is the cardiac cycle phases and autonomic nervous system modulation, as I told earlier, in case of the sympathetic and parasympathetic stimulations. So what happened? The heart rate increase or heart rate decrease automatically in the graph of the ECG. The very minor alterations are there, right? So the effects and the interventions, these are the similarities, and that is the two different graphs are there. Upper one is the human and the lower one is the rat ECG, and that is the dissimilarity to show that the timing for peer interval in case of the mouse is 30 to 56 and in a millisecond, and in case of the human 140 to 220. These are the differences, time differences, interval differences. Okay, so this is the rat ECG. You identify that the RR interval is less as compared to the human. RR interval are less. In case of the human, RR interval are more. Okay, so that is the dissimilarity features.
Okay, can we go to the last slide once? In these slides, just you mentioned that what are the structural differences are there.
Structural differences, yes sir.
In regards to human versus rat ECG, the structure.
Sir,
with one cardiac cycle, you
yes.
Take it in considerations and you just explain it.
Yes. Actually, here you see that the T wave is more prominent, right? And here the T wave is less prominent. And another one thing, the ST interval is less or more. And in case of the human ECG, the ST segment is okay. Another one thing.
However, here in the rat ECG, the graph you have given is not showing the P wave.
Yes.
Okay. So do you have any other graph in regards to that? So they can understand. In case of
In case of
let me say, in case of the conduction is so fast, in case of human being, you can find out there is one gap is there. If you see the P wave and QRS complex starting, okay. So if you can go to the human graph 1 second. That general ECG graph. The first slide, that prominent graph you show. Okay, that first slide is the prominent graph. So what you are seeing over here, that P wave and then one isoelectric line is there for the short time. Okay, and after that the QRS complex is starting. But this short difference, short gap between the P and the QRS you will be not getting in case of rat. And if you compare with the two smaller animals like mice and all, so again there will be no complete QRS complex you can find. So before the QRS complex or the S deflections downwards it comes, the T wave starts and it's A. So the conductions and all, these all things happen very fast in case of the smaller animals, and because of that the durations is less for a cardiac cycle or to occur or to complete a cardiac cycle. So because of that these are the difference are there. So and the heart rate difference are there, and the time interval, the QT difference is there. Each wave time difference you can find out when you compare with the rat and the human. So the smaller the animals, so it will take less time, and there will be the more rate. As it is taking the less time, so the rate will be more. So because of that, their heart rate and all is very high.
So that is the clinical relevance of the ECG and the late placement. In case of the human, ECG is a diagnostic tool to diagnose any type of myocardial infection or coronary artery disease or any other cardiac abnormalities. At first, we can identify by using the ECG interpretation, right? So screening and risk stratification and the response to therapy. Any drug is either cardiotoxic in nature or not. We can easily understood by interpreting the ECG data. Okay. By analyzing the QT interval, peer interval, RR interval. One question from my side, that is why QT prolongation takes place for the audience. Why QT prolongation takes place, or the QT prolongation that denotes QT prolongation denotes delayed repolarization. Always remember it. Okay. In case of the rat, in the preclinical research, to screen the cardiotoxic drugs, we use the ECG data. Physiological and biomedical research, as I told earlier, this is modeling and comparative medicine. So that is the late placement on human versus rat. Yesterday, Somdeep sir nicely discussed about the different electrodes and where that is placed, and the positive electrodes in case of the human, he used 6 late ECG, but we have Biopac MP36, that is actually, it has 3 leads. Okay, one is positive, another one is negative electrode, and another one is the neutral or ground electrode. And that is the rat model, how the ECG is taken in case of the small rodent, rat or mice, whatever it is. That is the ground electrode, and that is the left side of the rodent. We place the electrode over here, right side, left side, and that is the ground electrode, and we connect with the BioPack MP36, and by using a software we can easily interpret the data. Okay. So, what are the aspects? ECG standardization in case of the human, that is well established, because in case of the human 6 lead, 12 lead, 16 lead ECG machines are there. But in case of the small rodents, we generally use 3 lead ECG machine. Okay? So, cardiac anatomy, in case of the human, upright heart and adult sized thorax. Due to this, the placement of leads is very much easy. But in case of the rodents, due to smaller thorax, heart orientation, the lead placement is different as compared to the human. Okay? So, lead placement impact that affects the waveform shape and intervals, and in case of the rats, that is more sensitive to small changes in placement. QT interval, that is interpreted with the heart rate correlation. In case of the human, heart rate is less than the rodents, and